All right, we are going to get our meeting started. And I'll call to order our OCHN board meeting for July 22nd, 2025. At this time, if you can, please rise for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Could we have the roll call, please?
Mr. Young?
Here.
Mr. Furman?
Present.
Dr. Giles? Gave notice. Pastor Jones? Yes. Dr. Guadalupe? Here. Ms. Woodruff?
Here.
Dr. Hans? Ms. Newman?
Present.
Ms. Root? Ms. May? Mr. Smith?
Here.
Mr. Cowan?
Present.
You have a quorum.
Thank you. At this time, we need a motion to approve tonight's board meeting agenda. So moved. Support. A move and support. All those in favor say aye. Aye. All those opposed, the motion carries. At this time is the first opportunity for public comment. If you wish to address the board after being recognized, if you are in the audience or if you are online, please limit your comments to 3 minutes, and we appreciate the fact that you are before us this evening. Do we have anyone first online that wishes to address the board?
If you are online and wish to speak for public comment, please raise your hand at this time.
There's no one online. Is there anyone in the audience who wishes to address the board this evening? Being no one, we'll close public comment, and we will have a second opportunity for public comment at the end of the meeting. Don't blame people for not being here tonight. They're probably out getting ice cream or some other pursuit in this beautiful weather. I will do my best to keep it moving so we can all still enjoy the rest of the evening. At this time, one of the highlights of our meeting is always stories that inspire hope. And this evening, Vicki, if you would introduce our guest.
Sure. I'm Vicki Suter, Director of Rights and Advocacy. Today, our speaker is Ursula Bolton. I think that you will be impressed with the many things that she's accomplished throughout her life. Ursula is a member of the Recipient Rights Advisory Committee, so this is somebody that you appointed to that committee, and she's been on the committee for about a year or two. Yep, great. Great member, provides a lot of feedback in her opinion and ideas, and so I'm excited for her to talk about who she is and what she's accomplished.
Thank you, everybody. Good evening. I started my involvement with OCHN really when my son was had started receiving services at Easter Seals, and how that came to be, the relationship with OCHN was at the time there was a requirement that the contracts have a CAC. So I was on the Easter Seals Parent Advisory Council and was appointed by them to be on the OCHN CAC as their representative. And from that point, I kind of hit the ground running. It was a wealth of information for me being involved in the CAC. So that's kind of where I started. My son, this was back in, I think, 2007, since I've been involved over the years. As OCHN's representative for Easter Seals, I was there for several years, and I was the chair of the OCHN CAC. After I joined the OCHN CAC, I started attending a lot of trainings and getting involved with a lot of other things with OCHN. I became a certified peer support specialist and worked with peer choices. I received independent facilitator training, and I did some independent facilitation for some years. I just feel like my involvement has really inspired me to give positive messages to others and inspire others to use their voice. That's one of the biggest things is I feel like I've been able to use my voice and, learn how to advocate and, just be involved. And I think that's been really important because it just how it's affected me in my personal life. I've been able to stand up for myself and my family in a lot of different ways. And it's carried over to where I help a lot of other people advocate for themselves or find answers. And I was just telling Vicki, I help people with Social Security Administration stuff and VHS stuff and things like that. But I wouldn't have learned how to do all that if I hadn't been a participant with OCHN and CAC. It just opened a lot of doors for me, and I feel like through the people that I've met, the therapy that I've received, I also do receive services at TTI, that it's just really impacted my life in a positive way. I didn't know about my mental illness for a long time. It was in my late 30s, in fact, that after being involved with Easter Seals and OCHN, that I was evaluated and became eligible for services. So it's been a long time coming. I feel like right now, kind of fast forward to 2024, I got a bad infection in my leg and it had to be amputated. And I just feel like if I didn't have OCHN there, when I got out of the hospital, my case management services that led to me getting back into therapy and everything, this just would have been a really hard thing for me to just embrace. But with the support that I received from my friends and family also, and from my provider, I feel like I've really, really embraced my condition the way that I am. And I am going to, soon I will have a prosthetic leg, and I feel like if I didn't have my training through OCHN, I would not have been able to advocate for this leg because at first my insurance company denied me. And it's just things like that that really, being able to advocate and knowing that I have a voice in things and being able to do those things, I really want to credit OCHN for, because just my involvement has really led me to do a lot of things and be able to help a lot of other people. Oh, and I did, everybody, some of you might know me from MSET. I did work at MSET for several years. I was the CEO from 2012, and I worked there starting in 2007. So I did surveys, and that's kind of how I got also involved with OCHN. I started finding out about the provider network and the way the funding worked and all of those things. And working with MSET, I got to know a lot about what people wanted and their needs and those kind of things. And we were able to provide, I think, some valuable information to OCHN for, continuing with the services that they provide to the public. One of the other things I do want to mention, too, is after I had my incident with my leg, I received complex case management services. And the nurse that I work with, she really helped me to coordinate all my doctor's appointments. I was seeing 4 or 5 specialists at the time. And I worked with Susan, the nurse, here at OCHN for about 5 months. She worked with me to coordinate all my appointments. She went with me to my appointment with the prosthesis at Beaumont. She attended that appointment with me, which was really important to me. And it's just another service that I think is really good that OCHN provides. Does anybody have any questions for me?
Oh, thank you for coming and sharing this evening. And as Ursula has asked, does anybody have any questions for her? I have one, and then obviously, so if you could talk to folks out there, so to speak, similarly situated to where you were many years ago, what would you tell them?
To seek help.
Okay.
That's the main thing. I tell people, I actually give the screening number out a lot to people, because you need a professional, I think, to tell you that you are having issues, and in order to get the kind of help that you need.
Right. Okay.
So, yeah.
Good. Anyone else? Okay. Yeah, sure.
I've been knowing Ursula for a long time, and she has definitely been active. And I'm so glad that you were able to come and share your story with us tonight. Keep on keeping on.
Thank you.
Yeah, I would say that Ursula has been a great ambassador for many years to the folks that OCHN serves, OCHN as an agency. MSET was a unique kind of entity in that we contracted with them, and they conducted surveys that we needed with persons served providers. And the individuals that worked there were persons with lived experience. So that was a very interesting time, and we were excited to be able to support that organization for a number of years.
Great. Yes.
Just a comment. Just wanted to thank you, Ursula, for coming to share tonight, and as well as being a part of the RRAC. So I've only been a part of that group as a board liaison for a couple of months now. But you're always participating, providing really good feedback to the group, and so it's just important to have you there, and your advocacy skills, like you said, are very important for people in the community to hear that and know that it's okay to seek out help and have those resources. So thank you.
Thank you.
Ursula, thank you. Thank you for having the courage to come forward and tell your story. But also, I think my takeaway, I think all of our takeaway is we need more Ursulas in the world. So your job is to find others to carry on what you have started. Thank you so much.
I try.
Okay.
I do. Thank you. Thank you.
Our next item on the agenda is my report, and it's simply that we have been engaged since the Director of Health and Human Services announced a potential change in the way that services are delivered here in the state of Michigan. We have been advocating against this proposal, and I believe it was July 8th, Dana and I, along with Francis Carley and Trish Zimbo, went to the Oakland County Health Subcommittee meeting to urge them to pass a resolution in opposition. And on the 17th, that is what the full board did by a vote of 16-3. And we're distributing that resolution to our state reps, our state senators, others who are involved in this, to not only know they've already received our resolution, but also the county, because the system that was set up for the state of Michigan is set up by a statute, and the counties appoint all of the representatives. All of us have been appointed by the county, but more so, those funds that are received are based upon, especially with Medicaid, on the residents here in Royal Oak. I'm sorry. Not just Royal Oak, Oakland County. Sorry. But the point is that the county has a very vested interest, because if that money isn't guaranteed to becoming an Oakland County residents anymore, that's an issue for the county. Because as you know, we have a health department which doesn't deal as much with mental health issues as we do. But this is a very important issue to the county, and I know that the Macomb County Board of Commissioners is going to be considering a similar resolution, because I've been in touch with the chairman of the Macomb OCHN. So that is something we've been involved in, and having dialogue with the county commissioners on a regular basis about this situation. So that's really the extent of my report. The second item is CEO evaluation, and as the board knows, we have been involved in our annual process pursuant to contract with the CEO. And the Executive Committee, which is serving also as the CEO Evaluation Committee. We met, we went over all the information, all the board members provided scoring in a number of categories, and that was all compiled by our HR director, and we will have forthcoming to you that information and a recommendation in writing based upon, as you may recall, there's a matrix, there's a scoring system, and that's all in the contract that we have with our CEO. So that'll all be forthcoming to you no later than Monday, so you'll have 2 weeks to review it, to consider it, and if you have any questions, please feel free to contact me or anybody on our committee. Okay? So that is the extent of reports from the chair. And next we have board approval items. And the first is our recipient rights committee recommendation for a new member.
This is actually an appointment to the Appeals Committee.
Oh, I'm sorry, the
Yep,
Appeals
yeah,
Committee.
it is on there
correct.
wrong. So it is, Renee Junkins has been voted as a recommendation by the Recipient Rights Advisory Committee to be appointed to the Appeals Committee so that we are in compliance to have our 3 members from the RAC Committee on the Appeals Committee.
Okay.
I move to approve the appointment.
Is there any discussion? All those in favor say aye.
Aye.
All those opposed? The motion carries.
Thank you.
Thank you for clarifying that it was on the appeals board. I'm sorry, do we need a roll call vote on that? Pardon me?
You typically do, but I'll defer to you if
No,
you want to.
let's do it then. I apologize, and thank you for that. Why don't we go ahead then? We'll scratch that vote, and we'll go through the roll call vote as the chairman messed up. So go ahead.
Mr. Young?
Yes.
Mr. Furman?
Yes.
Pastor Jones?
Yes.
Dr. Guadalupe?
Yes.
Ms. Woodruff?
Yes.
Dr. Hans?
Yes.
Ms. Newman?
Yes.
Ms. Root?
Yes.
Mr. Smith?
Yes.
Mr. Cowan?
Yes.
Motion carries.
Okay. We'll now go to suicide prevention proclamation, and Suzanne, if you want to come up. There's not any, you don't have to read the proclamation, but if you just want to give a brief overview, and if there's anything you want to highlight, that would be fine.
Good evening, everyone. Nice to see you all again. Just to reiterate what I mentioned last week at the Committee of the Whole meeting, this is our Suicide Prevention Month proclamation, as well as I'm also bringing you the Recovery Month proclamation. But I'll start on the Suicide Prevention Month proclamation. I did read it last time, and I do want to bring one note to the board that I did, as requested, add a stat to the proclamation, and it's kind of halfway down. I'll read that stat for you. I just added the stat that Michigan reported 1,503 deaths by suicide in 2023, with 162 of these individuals residing in Oakland County. And that was the addition as requested by Mr. Cowan.
Okay. Thank you. I just want to add to that, the network is committed to being a zero suicide organization. We provide a lot of support. So if someone, a family member or a friend knows someone who is having challenges and they're concerned, they or the friend, family can reach out to OCHN and we'll get them the help that they need. So we can just make that pitch. But so this will be a resolution that goes out to school districts, governmental agencies, cities, townships, and hopefully they will also put that on their agendas and approve or notify their residents of the same.
I'll also add the faith-based organizations. Pastor Jones has committed to bring it to the faith-based organizations as well.
Good. So we have a motion and support?
Recovery Month,
No, suicide.
suicide.
Yeah.
The Suicide Prevention Month, proclamation.
A motion and support. Is there any discussion? A roll call vote, please.
Mr. Smith?
Yes.
Ms. Root?
Yes.
Ms. Newman?
Yes.
Dr. Hans? Ms. Woodruff?
Yes.
Dr. Guadalupe?
Yes.
Pastor Jones?
Yes.
Mr. Furman?
Yes.
Mr. Young?
Yes.
Mr. Cowan?
Yes.
Motion carries.
Thank you. And then also, September is a month of, we have both the suicide prevention, but we also have National Recovery Month. So if you want to give an overview of that resolution.
Absolutely. As with the Suicide Prevention Month resolution, we also, as you mentioned, celebrate National Recovery Month in September. There were no additions or changes to the proclamation, highlighted a number of statistics in the proclamation, also highlighted the importance of naloxone and how naloxone does save lives, as well as reducing stigma related to recovery. As with suicide prevention, this is another work that we put forth with OCHN. As mentioned, we'll be taking this forward to our cities, villages, and townships, as well as our school boards, faith-based organizations, and ask that they accept this proclamation either at their monthly meetings, or if they want to post it on their website, anything that they've shared on their social media, anything that they would like to do to promote this, to continue to highlight Recovery Month as well as Suicide Prevention Month.
Just want to note that fortunately in Michigan between 23 and 24 there was a significant decrease in overdose fatalities. And I think part of it has been because, not on a statewide basis, but certainly here in Oakland County, we've made the kits available, and we've made them available in public places, which, 10 years ago nobody would have even envisioned. But that's saving lives, and you're seeing it now. And I think much more awareness that has been brought forward to the community at large. So I think we should all be pleased. We don't want any overdose fatalities, but if it can continue to be moving in a downward direction, that's positive. And I'm glad we're a part of that as an organization, and advocating for those kits and their distribution publicly. And I believe the yellow boxes, is it the box?
The box is white, like a white and
White,
red,
okay.
and there's one
right
outside our building
I'm
here.
messing up with something else.
That's
So,
okay.
all right, but these boxes are throughout Oakland County in different places, and if you can't find one, then call OCHN and we'll get you a kit. You can come pick it up, or however we can get it distributed, so that it can be used in the future if needed.
I'll make note that there is one right outside
That's right.
our building here when you walk in the front door.
That's right. All right, is there a motion and support? So moved. Support. All right, is there any discussion? There being none, roll call vote, please.
Mr. Young?
Yes.
Mr. Furman?
Yes.
Dr. Giles? Pastor Jones?
Yes.
Dr. Guadalupe? Yes. Ms. Woodruff?
Yes.
Dr. Hans?
Yes.
Ms. Newman?
Yes.
Ms. Root?
Yes.
Mr. Smith?
Yes.
Mr. Cowan?
Present.
Motion carries.
Suzanne, thank you for all your efforts on both those proclamations. We appreciate
Thank you all so much.
Thank you. We now have the fiscal year 2024 audit report. And Mr. Carpenter
He's online.
he's online.
Yep.
And Richard, welcome.
Are you able to hear me okay?
We can hear you. Thank you. I just want the public to know, and those in attendance, that we did go over the audit last week at our Committee of the Whole meeting. I think we had a lot of questions answered. I know there was still a few small items that needed to be addressed. And Richard, if you want to give us a overview, and then let us know if there were any changes in the audit that we should be made aware of.
Absolutely. So we did end up finalizing the audits last week. As presented at the Committee of the Whole, we successfully completed the financial statement audit, the single audit, and the compliance exam audit. All got unmodified opinions, which is the cleanest or the best opinion you can get from an independent audit firm. We did have one finding related to the single audit. That finding had to do with the timing. So we were a couple of weeks past the filing deadline. That occurred because of some of the work we were doing on our balance sheet. We do not anticipate that to have any negative impact on the organization going forward. It was the least significant type of finding that you can get in a single audit. So that's good to know. On the compliance exam, there were some adjustments that were made to the financial status report that was between what was filed in February and what was completed in June. Those were described and again related to those balance sheet items that we looked through. So in general, a very successful completion of the audit for 2024.
All right, is there any questions? I know we went over this, but if anybody has any other questions for Mr. Carpenter regarding the audit, this is the time. I just have a couple quick comments that I think are important to note. First of all, as Richard mentioned, we had a clean audit, which is very important. That is the highest standard. Also, if you read through the audit, and a lot of it's pretty dry, but we've complied with all of the GAAP procedures, which is the generally accepted accounting principles, which are the professional standards in the accounting industry. And very important, that should be noted, much of the funds we deal with are federally mandated or received from a federal source. And we have an independent audit for that purpose. And we met our financial responsibilities with respect to those federal funds. And I think that's very important. We are stewards of funds that come from the public and are then actually, sent back to the public, so to speak, in services. So we take that very seriously. One other thing I want to note from our discussion last month is that we put from OCHN $24 million of our reserves into operations, and by that I mean that went back to services in the community because we are not adequately funded. But unfortunately, I've said this several over the past couple of years, but we now are at the breaking point. There is no more reserves to give. I mean, we're at the lowest level we've been at ever. So we're going to find a way to make it work. We're going to have to stretch those dollars just like folks have to stretch the dollars at home. And we're going to find a way to do that. I think we've taken a lot of steps to, in the future, for a brighter financial future. But never let it be said that OCHN did not step up to the plate when it was needed, and it was to the tune of $24 million out of our reserves. So I just think that's important for all to know. Any other comments on the audit? Yes. Oh, yes.
So the auditor's recommendation in the corrective action plan is that authority establish controls to ensure the audit is completed in timely manner. In the past years, when we have been told that the internal controls are satisfactory and in compliance, and we have also discussed that the staff needed training in that. What is the status of that?
I don't have the specifics. I'd have to, maybe Richard knows now, but as you know, we had a significant change with Richard coming on as the CEO. Richard, CFO, excuse me. Richard, did you hear the question?
Yes, we've identified that there are certain processes during which we close the year that we are going to be able to accelerate. So we're going to have those processes start earlier for 2025, and that will avoid the issue that we saw this year where we came right up to the deadline and unfortunately we were not able to meet that. So I expect that we will not only hit the deadline, we will be well in front of the deadline next year.
Yes, but in the past, we have been told that the deficiency was, or the corrective, or at least action plan was, part of it was that the staff needed training. And I think last we what I remember is that last we discussed it, that the training will be completed, or they expected it to be completed by the end of the calendar year. So we are already almost past midway. It's end of July. What is your impression about where we stand in terms of staff training? Because we have gone through several CFOs in the past 2-3 years. So I am a little bit concerned about this. Thank you.
Richard, did you have anything you wanted to add on staff training?
Yep. What I will say is that the first 90 days, so it's been 82 days today that I've been lucky to be with OCHN in the CFO role. The first 90 days is a lot of information gathering. I will say that there's been a lot of opportunity to interact with staff, and I anticipate that we will have modifications to the training plans in time so that we will be ready for closing 9/30 of 2025. So if you look at the corrective action plan, it does say that we have an anticipated completion date of September 30, 2025, and I do believe that we're going to be on track for that.
Okay, thank you.
Thank you. All right. There's no other comments, then we need to have a motion and support to accept the audit report.
So
Support. Motion and support. Is there any discussion? A roll call vote, please.
Mr. Smith? Yes. Ms. Root? Yes. Ms. Newman?
Yes.
Dr. Hahn?
yes.
Ms. Woodruff?
Yes.
Dr. Guadalupe?
Yes.
Pastor Jones?
Yes.
Mr. Furman?
Yes.
Mr. Young?
Yes.
Mr. Cowan?
Yes.
Motion carries.
The next item we have is the audit contract for BDO, which we discussed at the meeting last week, and I believe Finance recommended approval of the contract. Mr. Young?
Yes, after the bid process was conducted, there were 3 finalists. BDO was the both most qualified and the least cost by a long shot, to say the least. So the recommendation is to offer them a new 3-year agreement or a series of 3 one-year agreements. So I'll make the motion to move that forward.
Support.
Motion and support. Is there any further discussion? I found that BDO, I think, has been extremely professional in their services that they provided and very forthcoming with us and answered all the questions we had. And I'm satisfied that retaining them again will be positive for the organization. So, a roll call vote, please.
Yes.
Mr. Furman?
Yes.
Pastor Jones?
Yes.
Dr. Guadalupe?
Yes.
Ms. Woodruff?
Yes.
Dr. Hahn? Ms. Newman?
Yes.
Ms. Root?
Yes.
Mr. Smith?
Yes.
Mr. Cowan?
Yes.
Motion carries.
Thank you. The next item we have is our consent agenda, which includes approvals of our board meeting minutes and also of our various committees, recipient rights, citizens advisory, and also our May 2025 financial report, which was reviewed in detail last month with Mr. Carpenter.
Move for approval.
Motion? Support. Consent agenda items are not debatable, so we'll ask for a roll call vote.
Mr. Young?
Yes.
Mr. Furman?
Yes.
Pastor Jones?
Yes.
Dr. Guadalupe?
Yes.
Ms. Woodruff?
Yes.
Dr. Hans?
Yes.
Ms. Newman?
Yes.
Ms. Root?
Yes.
Mr. Smith? Yes. Mr. Cowan?
Yes.
Motion carries.
Thank you. Next on the agenda is other business. The item that I asked the board to at least informally give some information on is Macomb County has asked if we could have a tri-county meeting on August 21st, next month. And so we need to get back to them so that we can set it. It will be hybrid. It will be here live, but also you can join by Zoom if you had another obligation or out of town or can't make it. So if I could possibly just have a show of hands, we're not voting on it, but just to know who would plan on attending or consider attending on the 21st. August 21st, yes. No, it would be here. It would be here, right. Okay, all right. Right, yeah. Nobody's signing off in blood if something changes, but we wanted to make sure they wanted to make sure it wasn't a problem for our board, because they could have had it this month, but they just couldn't work it out among their board, so. All right, Sheila, if you want to let the Macomb board know that we're good with that date, and we look forward to meeting with them.
They're just confirming DWIN too now, so I'll confirm back with you that date's live.
Okay, we appreciate that, thank you. But just so, in terms of calendars for next month, that means that we have the board meeting on the 19th, the Tri-County on the 21st, and the 28th, that is an important meeting because we have both the budget and strategic plan that night. So it's hard to defer that meeting. So we're gonna basically have 3+ meetings next month. So just to let everybody know, and then you can have Labor Day weekend. Yeah, well, 4. I say 3+ because the Tri-County, right? And then you can have the weekend off for Labor Day. How's that? Is that a good deal? All right. So, 4 meetings next month.
Mr. Cowan, also
Yes.
to note, we have a hold on the calendar on the 18th, which is also a board meeting date, that we have a town hall scheduled for legislators the day before. I'm sorry.
On which day is that?
It's on the 18th. It's the Monday before. I don't know if board members want to mark their calendars for that.
Okay.
It's at 4.
What time
3:30.
is it? What time is it?
3:30. Oh, it's the whole.
Tell you what, why don't you get out a...
We're going to send you a calendar invite.
Send out I
Okay.
think what would be helpful is why don't you send out a calendar with all these dates and times for August?
Okay.
Because that'll be important for just a nice reminder. I mean, we all have most of the dates, but with these new ones, we'll be in good shape. Okay. Is there any other business that anyone wants to bring before the committee, before the board? There being none, we'll move on. Board reports, Recipient Rights Advisory Committee, Dr. Guadalupe.
I have nothing to report because we did not have a July meeting. We resume next month. Thank you.
Okay. All right, and Citizens Advisory Committee, Christina?
Mine's the opposite. I actually have 2 reports, so I'll make up for yours. So this month our CAC meeting happened to fall on the week before our general Tuesday board meeting, which often doesn't happen, and that's why I have 2 reports to give. So starting with June, our CAC meeting included a presentation from Sandy Dory of the Oakland County Parks and Recs about inclusive programming and services they provide to the community. Some examples she gave were quiet zones that are available, focus groups they've been hosting, and accessible equipment at park sites. And then our CAC meeting for this month was held last Wednesday online. Our OCHN Clinical Director, Adam Hamilton, joined our meeting to give a presentation on what PTSD is, which led to some good questions and comments in the group. And also in this month's meeting, we had Adele Gardenick join, and she presented on the School Mental Health Navigator Program. That's my report. Thank you.
Thank you. Now is a second opportunity for public comment. If there's anyone who wishes to address the board, again, please limit your comments to 3 minutes. And do we have anybody online?
If you are online and wish to speak for public comment, please raise your hand at this time. Beth, you can go ahead and unmute your microphone.
Hi, thank you. I serve as an independent sports coordinator, and I also am a mom to somebody who receives services with an individual plan of service. And finding staff is already kind of tricky. I have heard that there is a consideration of moving your 4-hour new hire class to in-person only, and removing some of the virtual options. And I would actually ask you to increase the number of options and also consider having options that are outside of the typical 9 to 5. And I'd be happy to discuss more if that's something that you would want to hear more on.
Well, what might be
Did
more
you say
effective
why?
is, pardon me?
Did you say why?
No, I did not.
Oh,
No,
okay.
what I said was what might be more effective is if there's a way to get a hold of you, then we could have someone who's dealing with that situation contact you directly. The board doesn't set up those types of meetings. We're certainly interested in them, and knowing that people are being receiving proper training. But is there a way that you could?
Yep,
Do you have an email or?
Yep.
Okay, good. We'll have someone get a hold of you tomorrow and follow up. Okay.
Fantastic. Thank you.
All right. Is there anyone else?
Hello?
Okay.
Hello, can you hear me? Huh? Good evening, are you able to hear me?
Okay. Yes, go ahead.
Okay. I'm calling, well, similar to what the last person commented on, regarding the new fire rate training. My name is Michelle Lasky, and I'm calling regarding the new higher rights training availability. I believe it's a very good training for everyone to have, and I am the mother and a guardian seeking services, and I have a couple people to begin in working through the ARC. However, the issue is with the new higher rights training, the availability is not there, and I've been looking like since June, and everything that's virtual is filled up, and then I'm being told now, even though they're can start today, they have to wait 3 weeks for training, and right now the next availability is until like August 14th. And for people who need the CLS and the respite, that's inefficient timing for me as far as and I'm more talking for anybody who needs that. Basically, there's a bottleneck there.
All right. Well, as I indicated with the last speaker, do we have information or, someone will reach out to you hopefully tomorrow and see if there's something we can work out, and what the options are. Okay? Because we've heard from a couple people tonight, and we'll have the team take a look at that. Okay?
One other comment on that is, I do know that the Michigan Department of Health and Human Services does have a webinar available. And I'm guessing if you're not able to provide it, I'd appreciate it if people had some type of a resource to receive it.
Okay. So it sounds like there's a fallback position, but we'll get back to you directly on what we're doing and take it from there. Okay?
Thank you.
All right. Thank you. Do we have anybody else online?
If you are online and wish to speak, please raise your hand at this time.
All right. Is there anyone in the audience who wishes to address the board? There being no one, we'll close the second public comment section. We appreciate those who called in. At this time, the director's report by Dana Lazenby, but she is not with us this evening as she's attending a conference representing OCHN. So I'm going to kick it over to Trish DeZimbo, our COO, to give a few highlights from the report.
Absolutely, thank you. I'm going to focus Dana's report, which we have in hard copy and will be posted online, I believe, and focus on our advocacy. I know we've talked about this for the last few months, and we have been out and about in the community and meeting with our partners to raise awareness on OCHN and reinforce the importance of the PIHP and how we play a crucial role in supporting individuals dealing with mental health issues, substance use, and developmental disabilities. So we have had some amazing meetings and have secured letters of support to our governor from our county exec, our Board of Commissioners chair, Sheriff Bouchard, all police chiefs in the county through our Oakland County Police Chiefs Association, 52 2nd District Court Administrator and judges, as well as Mr. Cohen had mentioned, the Board of Commissioners has passed a resolution in support. Dana has continued meeting with our House representatives and our senators from our county and other counties as well. We have meetings coming up and discussions with our partners from the prosecutor's office, as well as working closely with Community Mental Health Association of Michigan, amongst other partners. We have been keeping Francis extremely busy with all of our legislative and advocacy efforts. And I did want to let everybody know that we do have an advocacy webpage on our website. So if you go to oaklandchn.org, there is a link right there on our homepage. I believe it's in the menu as well as scrolling across the top. So that is a little update on what we are doing with advocacy.
Thank you very much. Any questions for Trish? There being none, we'll move on to our last item, which is board member comments, and we'll start, Christina, with you. Okay. Dr. Hans?
No comment.
Okay. Pastor Jones?
Let me say I was just really impressed with Ursula's report today. I tell you, that resiliency and the idea of her reaching out to others. It was very inspirational, very inspiring, and it was an uplift, especially in this day and age. So I'd like to comment on that and thank the committee for working, with her. Thank you. I know I spoke with you individually about the job that you do, and words cannot express the extra effort that you put forward and the commitment and dedication. So thank you very much for what you do and how you do. Thank you, Mr. Chairman.
I have to follow Pastor Jones. So I'm going to get kind of practical. I know we talked about a lot of meetings in August, but budget for next year is going to be critical, and it's going to take a lot of, like you used to say, the what ifs, because we've got what ifs on every level. So So for the cow meeting and for the study session, just to encourage everybody to either attend or be there virtually. Every year the budget's a very serious process. This year, it's also the full year impact of a lot of changes that were made last fall. So we're going to see, how things have gone. What went up, what went down, what went sideways. I mean, we made a lot of changes this year, and the state's going to add a few more. I know we've talked about fee-for-service. Got to look at that. It started July 1st, which is 3/4 of the way through a fiscal year. So I guess, Sheila, if you can, and Richard, I think is still on there for Richard, Robert, and Nasser to see, what's that first quarter look like, and how are we projecting what it's going to look like for a full year?
For budget projection?
Yeah.
Okay, because we won't really have that data until...
Well, as close as we can get. I mean,
okay.
There's a lot of swing variables, so we're going to.
I hear you.
Yeah. Thank you.
Yes, Adam?
I just want to reiterate what people have said tonight. It was great to see Ursula again and hear her story. She's been very prominent and visible over my involvement in, not only with the board but with the system at large, and it was great to hear her recap her story of triumph and independence, and also working with the supports we provide as well. So thank you again for that, Ursula, and thank you for all of the work that staff and others put into putting the agenda together for tonight's meeting. Have a good night.
Chris?
Sounds like I need to reserve my energy for August.
Okay. Yes.
No comment as well.
Okay.
No comment.
No comment.
Yes, I wanted to join my colleagues in thanking Ursula for coming and inspiring us. I also want to thank the staff for their preparation of many of the materials this evening. But one thing I did omit to mention about the audit is something we can all be very proud of. I don't have the exact calculation, but our administrative overhead for the organization is about 70% of the monies that we administer. That is very good. If you look at the industry of nonprofits, so to speak, and government and NGOs and governmental organizations such as ours, many times those administrative costs are much higher. So we're holding the. Oh, 7. No, 7%. I'm sorry. Did it come off? No, I meant 7. Well, boy. And I apologize if it came out wrong. Boy, wars have been fought over less, so I'm in trouble. But no, 7. I'm sorry if that came out bad. But 7% is phenomenal in many circles, and that allows 93% of our dollars to go to services. So that is very, very important. And the reason I mention that and highlight it is because our statewide organization, CMHA, has said that if the Director of Health and Human Services proposal goes forward, that because of the overhead by private companies and those who would be involved in this would exceed and far exceed 7% of administrative overhead, that would immediately take $500 million out of the system statewide. And with the pressure that we're facing with respect to the most recent federal legislation, and we don't really have a handle yet because we're waiting for the state to kind of sift through of how this impacts all of us in the community that provides mental health services. We'll have to wait on that to see exactly how it's going to work. We know the state's going to have to come up with more money. The state's, that's very clear. The state's contribution is going to have to be greater. And we all need, all those involved in providing services, us at OCHN and those we serve, all need to be advocating right now to make sure that the state is going to step up to the plate. They're going to provide those funds so that we can be funded at least at the levels we're at now and hopefully better into the future, and they can make mental health a true priority for the state. So those are all some of the challenges we're facing, and as John mentioned, the issue with the budget is going to be, we're going to base a budget based on what we know, and things may change during the year as they did last year. And so but we think we're in a better position. We put into place some things you've mentioned that we will hopefully will help us stretch the dollars a little bit better to those we provide services to. So on that, I will stop, and at this time, we'll adjourn the meeting, and thank you very much. There's still time to get an ice cream, take a walk, or do something really nice in this great weather. Boy, something must have came out bad. Did it sound like 70?
Oh, yeah.
Oh.